Gosh, you just never know. This movement has been growing, and there's so many people nationwide that are really pushing this movement forward. I think our event did help to get us a little bit of national attention, and since then people have just kept building the momentum, which is awesome, and we've just kept it going. We're getting more and more press, and so I'd like to think that it contributed in some way to that. We've seen the gist of it. It's very disappointing because it doesn't address the fundamental problems we have in this country. It still places barriers to care. People will still go bankrupt. We still have all these different insurance companies that we have to deal with, and they're restricting care and denying care. None of that changes until we get those private insurers out of the equation. That's why we're asking for real health reform, national single payer. Yeah, I mean, that's the only thing that the insurance companies are going to agree to. They've been saying that from the get-go, and I think the individual mandate is an integral part. It's actually now called an individual obligation, which is meant to make us feel like it's our duty, unfortunately. I think it was a real mistake to think that you would bring this industry. It's like, let's bring the tobacco companies to the table and have them decide how we're going to regulate tobacco, It's just, it doesn't make sense. If we're going to really talk about healthcare, it's got to be the real people, the people that are providing healthcare and the patients. This is unfortunate. We definitely saw from the very beginning that this was a very tightly scripted, on message. The current health reform for the White House and Congress was very much meant to lead everybody in the country towards this common conclusion that would include the private insurers with the mandates and the public option and all that. It was never a discussion. It was never about what's best for us and the health of our country.